Are you able to get the health care you need at a price you can afford? This was just one of the questions in the National Health Care Survey sponsored by the country's largest union group. More than 23,000 people took part, not all members, and did include 1,300 Floridians. The high cost of health care, the focus of a new survey released today at the local AFL-CIO chapter in Opelika. Louis Maurice talked about his son.
Just by looking at him, you probably wouldn't think that he had open heart surgery before he was a year old. Okay, it cost us close to $300,000. Just about lost all my life savings. And that's with having health care and a good job.
In Florida, 72% of the survey respondents reported spending more than $1,000 on out-of-pocket health care costs last year. And 40% reported skipping medical tests, treatments, and follow-up because of cost.
You can find the best health care here in this country, but so many people who live here simply do not have access to that health care.
Today, President Obama stressed the need for a government-sponsored insurance plan.
For us to be able to say, here's a public option that's not profit-driven, that can keep down administrative costs, and that provides you good quality care for a reasonable price.
In a letter to senators, two insurance industry groups warn a government-run plan, no matter how it is initially structured, would dismantle employer-based coverage and significantly increase costs for those who remain in private coverage.
That defies logic, which is why I think you've seen in the polling data overwhelming support for a public plan.
Dr. Bernd Wollschläger of North Miami Beach is a delegate for the American Medical Association, which does not currently support a public option.
A patient should have the right to choose his physician, should not be dictated. The physician should have a right to fair reimbursement, for real reimbursement for the services rendered, and not for diminished reimbursement that doesn't even cover the overhead often for the services, and then physicians drop out of such a servicing such a public option system.
While debates over reform plans continue on Capitol Hill right now in Florida, there are 4 million people without health insurance. Live in the newsroom, Diana Gonzalez, NBC6.